Okay. Going to change this around here real quick. Um, and see if I can. Oh, there we go. Of course, the width, we want that way. Apply. All right. I haven't figured out what I'm going to name this little session I'm going to do here right now. I'm going to use my 62. I'll fork out. I haven't put anything on here for a little while. Not that many people check me out anyway. I'm going to ask for, if you'll listen to, it's not going to be very long. I'm just going to do a little chip and when I talk about it. But this is about medical stuff. Not a doctor. I'm not saying to go do this or that, any of that crap. So I'm just telling you about something that's happened to me recently. And maybe if you got something going on, you had something going on, maybe this will help, maybe it won't. Kind of just a heads up. Here, a couple weeks ago, I just got done practicing out here, and I went after it pretty good, and I was, I could feel it, not too bad, but yeah, I could feel it. 75, out of shape, yeah, and so I started kind of getting a little bit of a pain right here. Thought, oh man, that muscle's sore. Went to bed. Next day, man, that thing was just stayed sore. So I thought I'd take a day off or two, and so I went to bed that night, and I lay down. Then all of a sudden, man, I got some horrible pain in here, in this area, and man, it was hurting like hell. So I got up for a while and laid back down, and it was about 9:30 or so. I told my wife, you're going to have to take me in the emergency room. I don't know what's going on here. And so we got up, went into the emergency room, and we got there about 10:30. Within the first hour, they had a urine sample, blood work, and they took, I think it was a CAT scan. Machine. Breathe in, hold, that kind of thing. And about 4 in the morning, the nurse came by, and I said, I want to get out of here. We've been here a long time, and I said, you had everything you needed from me the first hour. Well, we have 22 patients in the emergency room right now and only one doctor. And I said, that sounds like a personal problem. The way the hospital charges and stuff, who's ever in charge? You ought to have another doctor on. I said, she goes, well, wait just a minute. So, well, then I told her, I said, I got to take a piss. And so I left. She left. She came back with the doctor about 10 minutes later. The doctor goes, yeah, she said you're getting ready to take off. I told her, don't let him take off. I looked at his stuff a long time ago. So there is that. That's just an aside from what I really want to get to. So she goes, yeah, all your blood work came back fine. But I'm looking at your picture here, and yeah, you have a large cyst on your kidney, but it looks about the same as the last time we took a picture of it. And my wife and I both at the same time. Pardon me? Yeah, it looks like it might be a little bigger. I said, no, did you say I have a cyst on my kidney? She goes, yeah. Yeah. And we have a picture of it from last time. I go, I never knew I had a cyst on my kidney. My wife goes, I never knew he had a cyst on his kidney. So apparently in 2012, they took a picture. I don't know for what reason or whatever. I'm still digging into that. But there's a picture there of this cyst. It's of which she says, I have yet to see the actual picture. She says it's about that big, size of my fist. And then she just goes, well, you know what? Usually those are nothing. So, check with your doctor and stuff. And but that looks okay. And I go, well, I came in for this pain in my side back there. Is that it? And she goes, well, a lot of times those are usually not known for causing pain. So we finally got out of there about 4:30. I got lucky. Called the next morning. I got in early that afternoon to see my doctor. And I told him what happened. He said, yeah, I see you're in at the emergency room. I go, yeah. And he says, yeah, it says you have a cyst. I go, yeah. I said, you got the pictures? He goes, no, I don't have any pictures yet. And he says, I think I'll have you go get some, and we'll get some with contrast. That way we'll see exactly what we're dealing with. I go, okay. So on our way home, the doctor calls me and he goes, hey, I want you to make an appointment with a specialist right away. I did get those pictures, and yeah, that's a pretty big cyst. And he didn't say much past that, and he said, I will call and tell them to get those contrast pictures to get you in, ASAP, and, we'll try to hurry that up. Well, I got lucky because 2 days after that, I was able to go in the morning and get the CAT scan with the contrast. And 2.5 hours after that, the specialist is from Eugene. I'd been seeing about some prostate stuff. And he was in town because he has an office down in this area too. And so I got the picture, so I went in and saw him. And he says, well, I don't have those pictures yet. And he kept looking and kept waiting for him to come in. He goes, well, here, I've got the ones from the emergency room. So he got on there and he started looking at them, and he's going through them and stuff. And he goes, yeah. And I could see him right there, and he goes, yeah. He said, yeah, that's a pretty big cyst. He said, usually those don't cause pain. I'm not very concerned about that, but, and he's going like this, and he goes, but that right there really worries me. That's a tumor. And guess what? If you was to take off, well, it's about that big around. Not quite as big as my fist, probably 2/3 the size of my fist. There's the fist. He said, that really worries me. And I said, well, we have them with contrast. And he says, well, here's the deal. We can't really say, we need to get those pictures and stuff. He says, same thing that the doctor at the emergency room said. Those don't usually cause pain. I don't know if he was talking about the tumor also or just the cyst. But he said there's 4 things that usually happen. Because that is so big, probably eliminating 2 of them right now without even looking at those films. The first one is wait and see how it does. He goes, that's definitely gone. He goes, sometimes we can take a needle, we suck that out of the cyst. I don't know if he's talking about the tumor also or just the cyst, but we suck the fluid out and then we put some stuff in and it does whatever it does and then you'll never fill up again and you're okay. He says, but it's too big. Usually up to about yay size we'll do those. Once you start getting bigger than that. So part of one of the reasons I'm making this, if you guys out there have been told you have a tumor and it's not that big, it's no big deal, might want to revisit that. Because if they can go in there and suck that out and not have it flare up again, because I don't know if the cyst being there invited the tumor in, or if it just showed up. I don't know how that works. It's some stuff I'm going to ask the doc once I get up there for surgery and stuff. But anyway, and then he says, so that's out. The option we like to do is we take it out, but we try to leave as much as the kidney as we can. And if that's not possible, we have to take the whole kidney. Well, about 2 days after he left, got a call from his nurse. He finally got the pictures, and she said, unfortunately, we're going to have to take the whole kidney. It is so deep that it's almost into the, I believe she said collection area, but it's in that deep, and she said there's no way that we can take that out and leave any part of the kidney. So I was a little bummed out. So anyway, and I'll be losing a kidney. So the next thing to go along with this is been waiting now to get scheduled for surgery. It's been a week, a little longer maybe, a day or two, because they said wait for a call, we're going to get you scheduled. And I called them this Monday, and said, hey, I fibbed a little. Hey, did I make a mistake? And I know I didn't make a mistake. I know that what they were saying to me, and that they were going to get in touch. And I said, was I supposed to call you? Or, yeah, well, I think they're waiting on the insurance to okay it, which could be feasible the way insurance is anymore. So yesterday went by, my wife, she was looking in all the portals, and the specialist, their portal wasn't updated with the visits or anything. So she called them, and they said, yeah, I see all the notes here. Yeah, we haven't gotten a portal yet. And she goes, whoever she dealt with was really nice, and she finally got hold of the surgery section. And while they were on there, they scheduled it, and it's in January, middle of January. And so a couple things. The one thing I'm putting it on here is not to tell my life story, or in fact I'm going to have a little surgery, is that if you're older, even if you're younger, if someone tells you got a cyst someplace, maybe you ought to just deal with it right then if you can. I mean, even though they sit there and say, yeah, these things, they don't really turn into anything ever. And so, it's going to be fine. No sense in really going and getting it. And that might be true for a lot of people. I would say, suppose you're not one of those lot of people. I always tell my kids, well, yeah, how often does that happen? I always tell them, nothing ever happens until it happens. Then if it happens, and it happens to happen to you, well, there you are. So there's some things you might want to wait around on, some things you might not in life, and it's good to have that, well, that doesn't happen often attitude. On the other hand, nothing ever happens until it happens. Yeah, I mean, I've lost 2 sisters to drugs, one to alcohol, and had some cousins that were suicidal. I mean, some bad things, and you don't think any of that's coming your way until it happens. So, I guess I just wanted to put this all out there because I didn't know I had the tumor or the cyst. I really didn't know that. That was a complete shock when she said they took a picture in 2012. One of the things I will say, though, like I said, that tumor is that big around. It's hanging out with the cyst. The emergency room doctor never mentioned it. All she saw was a cyst. They had a picture from 2012 that had a cyst on it. Yeah, that's just that. It looks like it might have grown a little bit. Probably the shadow, because he had to move around where the cyst was to see the tumor. And so I guess what I'm saying is take care of yourself, and You know, take care of those little things. You never know that. I don't know. Don't never listen to me. I'm always apprehensive when they said, "Oh, that," when they say that's nothing, it's not going to turn into nothing. Like I said, my attitude has always been for a long, long time is nothing ever happens until it happens. And I don't spend my whole life worrying about anything happening, but you know, if I always have a chance to go one way or this way, I go the way it takes care of stuff. So apparently, except for that cyst, I still don't remember anybody ever telling me I had that. They might have. And one last thing, I'm out here. I'm just going to do some light chipping. This might be the last time I do it. But because I don't know how much moving around and stuff I do. Right now, everything, there was a big relief. Although I'm losing a kidney, everything seems to be located in one spot. But how much do I move around? How much activity do I do? You know, we've all heard of someone or know somebody. I know some people. They're not with us anymore. But they got checked for the cancer and stuff. They got a clean bill of health, and then in a few months they were dead. And you hear stories like that all the time. They just checked him out, or they just took it all out. They said they got everything, and so this is sitting there, and supposedly without looking, I don't think there's 100% guarantee that they can do without really being right in there. So take care of yourself. And one last thing. One of the reasons I hear that it's scheduled out, he's getting an operating room for 6 hours. Apparently he said this is going to be a tough one, I guess, for what it is. But one of the reasons is I'm fat. So, I mean, I've been a big guy all my life. Most of the time it was husky, you know, big muscles and stuff, not this stuff hanging here, but, you know, in really good shape. But for a lot of years now, I've got this. So get in shape best you can. Try to lose a little weight. I'm going to try to drop 20 pounds before the surgery. I've already dropped some weight because I've been trying to. I wanted to get some weight off my knees. But I'm going to try to lose another 20 before the surgery. I'll do anything to help out. Trust me. I'd like to come out of that and have them saying, hey, it wasn't any place else. It's good. We took it. You're going to be going off of one kidney, but you should be okay. So the reason I did the video is just to let some of you know, whoever watches it, and pass the word around, you know, if you got a sister, go back, get it taken care of. I don't know if that's what helped cause the tumor or whatever. And go to a different emergency room than I went to. I mean, how if you're looking around at that picture and you care if the guy's hurting or not, well, you just notice that there's a cyst there, and was a cyst in the past, and you go, oh yeah, that cyst there. It looks like it might be a little bigger. You don't move it around and look. He found that within about a minute. The specialist, when he got him and he looked, he goes, yeah, that doesn't bother. Wait a minute. He said, yeah, that one doesn't bother me, but that worries me a lot. About that quick, the way he did it. It would have been nice if she would have done it. Now I feel glad that I didn't take it for granted that's been there and there's probably nothing. And I looked. And I still don't know what the hell's hurting. So I'm going to finish hitting these shots. Please don't watch anymore because I haven't been swinging the club at all. I'm going to swing these real easy. When that tray's empty, I'm done. There's about 15 golf balls in there, maybe not even that many. But keep swinging them out there. Have fun and take care of yourself. That was the main thing of this. Just take care of yourself, and if you get something to check out, get it checked out, and you know, take the best road forward. And good luck to all of you. Oh, I'm leaving this on because I want to see how horrible I look swinging the club. Whoops. Damn. There's the old hosel. That ain't going bye-bye anytime soon, is it? What's the roll on that? 7. All right. There we go. 50.9. All right. Whoops. Pulled that thing. Dang it. Oh, way too hard. Nope. Scold it. Can't hit it straight. Nope. Horrible. All right, come on now. There we go. That's better. Almost like I tried. Nope. Did not hit that good at all. Ah, damn. No. Come on now. Gotta do better than that. Four more. Damn. 6-2. Nope. Short and left. Oh, ugly. That was ugly. Oh, darn it. Length might end up good, but left. Last one. If I ever get to play the holes of rocket. Nope, short. Dang it. Huh? Not bad, though. All right. That's enough of that.